Do you feel tired even after a good night's sleep? Are you constantly thirsty, even though you drink water? Or do you feel hungry again shortly after eating? If any of these situations sound familiar, your body might be trying to send you a silent, but urgent, warning. Before we continue, don't forget to like this video and subscribe to the channel. It helps our content reach more people and can make a real difference in the life of someone who hasn't yet recognized the signs their body is giving. Today we're going to talk about a sneaky condition that may be developing without you even realizing it: prediabetes. It doesn't sound the alarm with sirens, but instead reveals itself through small symptoms that, if ignored, can develop into type 2 diabetes, with all its complications. The good news: this condition can absolutely be reversed. But first, you need to recognize the signs. One of the first warning signs is frequent urination. When blood glucose levels are elevated, the kidneys try to remove the excess sugar by flushing it out through urine. This process, called the osmotic effect, pulls more water into the renal tubules, which significantly increases urine volume. The result: you start going to the bathroom multiple times a day, including at night. This excess fluid loss leads to another common symptom: constant thirst and a dry mouth. Even though you drink water regularly, your mouth still feels dry, and your thirst doesn't go away. That's because so much water is being eliminated through urine that your body loses more fluid than it should, leading to a state of mild but persistent dehydration. Another important red flag is excessive hunger that never seems to go away. Insulin resistance, common in prediabetes, prevents cells from absorbing the glucose circulating in the blood. As a result, the body believes it's running low on fuel and sends hunger signals, even after a full meal. This imbalance is also connected to the dysregulation of hormones that control appetite, such as leptin and ghrelin. But the signs aren't always obvious. One of the most dangerous is what we call slow wound healing. Small injuries that would normally heal in just a few days take much longer to close. That's because excess sugar in the blood damages blood vessels, reduces circulation, and makes it harder for nutrients and oxygen to reach the injured areas. On top of that, the immune system becomes less effective, increasing the risk of infection. Constant fatigue is another common symptom, and it goes beyond physical tiredness. Even after sleeping, you may feel drained, low on energy, and struggle to complete simple tasks. Once again, this is due to insulin resistance, which prevents your cells from using glucose as an energy source. Add to that hormonal imbalances and poor sleep, often caused by sleep apnea, which is common in people with prediabetes, and the problem only gets worse. Another sign that often goes unnoticed by many people is blurred or foggy vision. When blood sugar levels remain elevated for a long time, they can temporarily alter the shape and flexibility of the eye's lens, making it harder to focus. In addition, this excess glucose can lead to fluid buildup in the retina, a condition known as diabetic macular edema, which compromises visual clarity. If not controlled, high blood sugar can also damage the small blood vessels that nourish the eyes, increasing the risk of complications such as cataracts and glaucoma, serious problems that may develop silently. That's why sudden changes in vision quality should always be carefully investigated. Another common but frequently overlooked sign is recurrent infections, especially in the gums, skin, or urinary tract. When glucose levels are high, the immune system functions less efficiently, making the body more vulnerable to bacteria, viruses, and fungi. In the mouth, for example, high sugar concentration in saliva promotes the growth of microorganisms that cause gingivitis and persistent infections. In the urinary tract, sugar eliminated through urine creates an environment that encourages bacterial growth, which can lead to frequent urinary tract infections. And when blood circulation is poor, the delivery of immune cells to infected areas is impaired, causing these infections to take longer to heal. Have you ever felt tingling or numbness in your hands, feet, or legs, especially at night? This is a concerning sign that peripheral nerves may be getting damaged by elevated glucose levels. This condition is called peripheral neuropathy, and it's directly linked to prediabetes and poorly managed diabetes. In some cases, the tingling may come with burning pain, stabbing sensations, or even the feeling of electric shocks. This type of nerve damage also affects motor coordination, balance, and even sensitivity to heat and cold. It's as if the nerves slowly begin to malfunction, and when that happens, quality of life is seriously impacted. Another curious symptom that few people associate with blood sugar is poor concentration and slow thinking. The brain requires a steady supply of energy to function properly, and when blood sugar levels fluctuate constantly, sometimes too high, sometimes too low, cognitive functions are disrupted. This can show up as difficulty focusing, memory lapses, or a sense of brain fog. These signs affect not only productivity, but also emotional well-being and even self-esteem. Forgetting appointments, feeling mentally sluggish, or struggling to make decisions can lead to frustration and anxiety. And when you add constant fatigue into the mix, the result is a cycle of physical and mental exhaustion. Sometimes, a sign that should raise a red flag ends up being mistaken for something positive. That's the case with sudden, unexplained weight loss. Although it might seem like a desirable outcome, when it happens involuntarily, it can be a sign that the body is struggling to use glucose as its main energy source. Without being able to properly fuel the cells, the body begins to break down fat stores, and even muscle mass, just to maintain basic functions. In addition, with more fluids being eliminated through urine, dehydration also occurs, which further contributes to the weight loss. In more advanced cases, appetite may decrease as well, worsening the situation. That's why any significant and unexplained weight loss should be investigated, especially if it's accompanied by fatigue, excessive thirst, or frequent urination. Among the more sensitive, yet often overlooked, symptoms is erectile dysfunction. Proper blood flow is essential for achieving and maintaining an erection. However, insulin resistance and high glucose levels can damage the blood vessels and nerves responsible for this process. Hormonal imbalances, especially reduced testosterone levels, also interfere directly with male sexual function. The good news is that when prediabetes is reversed, many men notice a significant improvement in this area. In other words, the problem can be solved, as long as the root cause is addressed. Another symptom that many people experience but rarely associate with blood sugar is constant irritability and sudden mood swings. An imbalance in glucose levels interferes with the production of neurotransmitters like serotonin and dopamine, substances that are directly linked to mood, motivation, and emotional well-being. When these neurotransmitters are disrupted, emotional instability, impatience, anxiety, and even depressive symptoms may arise. Add to that poor sleep quality, chronic fatigue, and the physical discomfort caused by prediabetes, and you have the perfect storm for bad moods. It's as if the body is constantly on edge, drained, and running on empty, which naturally affects how a person responds to daily challenges. Now imagine going through all of that and also dealing with dry, rough, and itchy skin. This symptom may seem like just a dermatological issue, but in reality, it's deeply connected to dehydration caused by excessive urination, poor circulation, and nerve damage in the skin, all of which are triggered by high blood sugar. On top of that, the malfunctioning of sweat glands, which regulate the skin's natural moisture, causes the skin to lose its protective oily layer and become even drier. In some cases, this dry and altered environment promotes the growth of fungi, like candida, which can cause itching, redness, and recurring infections in sensitive areas of the body. One of the most characteristic and dangerous signs of prediabetes is the excessive accumulation of abdominal fat. This localized fat isn't just an aesthetic issue, it's directly linked to a silent inflammatory process happening within the body. That's because when cells don't respond well to insulin, the pancreas begins producing more of this hormone. This condition, known as hyperinsulinemia, promotes fat buildup, especially around the abdominal region. This type of fat is among the most dangerous, as it surrounds vital organs and significantly increases the risk of cardiovascular disease, while also accelerating the progression of insulin resistance. That's one of the reasons why people with increased waist circumference should be extra vigilant. But here's the good news: prediabetes can be reversed. Yes, it's entirely possible to prevent this condition from progressing into type 2 diabetes, as long as you start taking action now. The first essential step is to transform your diet. A balanced diet rich in vegetables, legumes, whole grains, lean proteins, healthy fats, and low glycemic fruits is the foundation for stabilizing blood glucose levels. And all of this can, and should, be done with enjoyment, guided by a nutritionist who can create an individualized and sustainable plan. Drinking plenty of water throughout the day is also fundamental. Proper hydration helps the body eliminate toxins, improves circulation, and reduces the risk of blood sugar spikes. Many times, constant thirst is mistaken for hunger, so staying well hydrated is a simple and effective strategy to support glucose control. The second pillar is regular physical activity. Walking, cycling, swimming, or dancing for at least 30 minutes a day can significantly improve how cells respond to insulin. Strength training, such as weightlifting or Pilates, is also highly beneficial. With the support of a fitness professional, you can develop a workout plan that fits your reality and needs. Additionally, avoiding excessive alcohol consumption and quitting smoking are essential steps. These substances directly interfere with how the body processes glucose, increase oxidative stress, and worsen insulin resistance. Speaking of stress, taking care of your emotional health is vital. Chronic stress releases hormones like cortisol, which raise blood sugar and create a pro-inflammatory environment. Practices such as meditation, deep breathing, yoga, or simply spending time with loved ones can help restore emotional balance. Getting good sleep is also a crucial factor. Poor sleep affects hormone production, disrupts appetite regulation, and impairs insulin sensitivity. That's why it's important to maintain a healthy nighttime routine. Avoid screens 2 hours before bed, keep your environment dark and quiet, and stay away from heavy meals at night. These simple practices can make a big difference. Finally, always stay on top of your medical checkups and perform regular tests. Monitoring your blood sugar, lipid profile, and kidney function helps detect imbalances early. The support of friends and family is also important. Sharing goals, challenges, and achievements with those around you increases your chances of success on this journey of transformation. Now tell me, how many of these signs did you already know? Have you noticed any of them in yourself or someone close to you? Leave a comment. Your experience could help someone else. And of course, share this video with someone you love. The right information, at the right time, can save lives. If this content was helpful to you, don't forget to like the video and subscribe to the channel. We're preparing many more videos with valuable guidance to help you take care of your health. Thank you for watching, and see you next time.